Good evening, everybody. So today's topic is diplopia. What is diplopia? Diplopia is a symptom of the patient saying that he's seeing double. Whatever he sees or focuses is seen double. So in this case, double vision can be of one eye or it may be of two eyes together. So that first thing we have to find out whether it's a double vision of one eye or it is of with both eyes. How to find out? We have to ask the patient to close one eye and see whether still his patient is having double vision, alternate closing and see which eye is having double vision. And about the binocular diplopia, that means with both eyes open, if the patient has got double vision, that means you will have idea that diplopia is of both eyes open. So in this case, we have to find out what is the reason of uniocular diplopia first. Now, uniocular diplopia, the cause may be in the cornea, it may be keratoconus, one condition known as a keratoconus, or maybe some little opacity in the pupillary area, or some scar, or even dryness also can lead to multiple images rather than double vision. So this is about the uniocular diplopia, and many other causes are there, like for example, subluxated lens, or the subluxated or just displaced contact lens also can lead to diplopia. So only by examination you will have idea whether a patient is having uniocular or binocular, and if it is uniocular, what is the reason? So now we are going to talk about binocular diplopia. In binocular diplopia, sudden diplopia is there. Always the cause is muscle palsy. Muscle palsy means it's a nerve palsy. Most common is a 6-nerve palsy. The causes are diabetes or some injury, or maybe myasthenia gravis or Graves' disease, or very risky thing is in the intracranial region, where if there is a pressure, ICT is increased, also can lead to diplopia. So fundus examination is very important to find out whether there is any disc edema, so which will tell you that there is an intracranial pressure is increased. And about the nerve palsy, again, you have to do many investigations like MRI, brain, and rule out diabetes, rule out myasthenia gravis. All the causes you have to rule out. Even sometimes the patient also can get double vision if there is a convergence insufficiency. So whenever the patient looks at near vision, near focuses, there is a double vision because of insufficiency. Also can lead to diplopia. So we have to find out whether even refractive error is there or not. That is very important. And because of diplopia symptoms, patient can get little nausea, feeling, headache, strain in the eyes, or while looking at particular region, he may have pain in the eye. And depends upon the cause also, you will see all other signs like myasthenia gravis signs, lactosis, and about the Graves' disease also, you will see all other signs. So only by examination, you will have idea. And if required, you might have to go for a CT, MRI to find out the cause. So whenever there is a sudden diplopia, it is very difficult to treat that time. How to treat? First thing, whenever it is a binocular vision, you have to close one eye or patch one eye, and then you can go on doing investigation. Otherwise, there'll be a very confusion when you walk. Eye exercises also you can do. You have to check blood sugar, everything. But at that time, there is no treatment in allopathy. You may give B1, B6, B12 tablet and investigate. So there are many other pathies during that time can be helpful.
Hello, I hope you can hear me and I hope you can see me. So, so Dr. Pushpa has already discussed about so much in detail about the clinical pathophysiology of diplopia, the clinical syndromes behind the symptoms of diplopia. So it's very important, even in a homeopathic approach, to understand what is the reason for the diplopia, what is the clinical background for it, because this will also help us to understand what we to prescribe. Because for different kind of clinical pathologies of diplopia, the homeopathic remedies are different. There are certain homeopathic remedies acting on certain areas in the eye. For example, I'm just giving you an example. For example, phosphorus has a good action on the retina. For example, calcarea fluor has a good action on the lens. For example, Staphylos aureus and pulsatilla has good action on the eyelid tissues. So understanding the sphere of action and the pathology, what Master Burnett and what Master Boger also spoke about, is very, very important. However, in homeopathy, there is really no specific. The idea is to really go at the deepest level and find a remedy that matches the entire state, the state of mind, how that person reacts, how that person visualizes the world. What is his sensitivity? What is his fear? What is his crisis moment? What is the past history? What is the family history? What is the genetic tree? Based on all of this, we choose a homeopathic remedy based on that. You let me share the screen. So there are certain homeopathic remedies, although which have a marked action on diplopia, clinically well known in that way. So I'd like to talk to you a little bit about that. Some homeopathic remedies that I wanted to know about. One of the very, very important remedies, which is extremely important, that you should know about, during the fever when a patient develops diplopia. One of the most important remedies during the fever and during headache, the most important remedy I want you to remember is gelsemium. This is a very, very important remedy for diplopia, along with headache and fever. This is something that should always be in your mind whenever you think about diplopia. Because gelsemium acts on the ocular muscles along with onosmodium and physostigma. This remedy has an action on the kind of ocular muscles that you should know. Very often when retina is affected, and then diplopia is the reason. One of the remedies is pulsatilla. You can see this clinical rubric. Diplopia in due to retinal hyperemia. I'm really trying to show you in our homeopathic literatures for more than 100 years what all is clearly written and how we can understand it in as much detail as much possible. Some smokers, people who have drinking or eating too much of, like smoking, tobacco chewers, very often they may develop diplopia a little later. Here, the remedy of choice is often Nux vomica. Another very important remedy is tabacum. It's not written in the repertory, but tabacum and Lobelia inflata. There is so much more. You'll have to really go through the repertory and understand all of this. But my idea was to give you a clinical kind of background to how we understand in homeopathy. In our clinic here in Mumbai, Dr. Pushpa, myself, our clinical team of doctors, we work together to help patients with ophthalmic issues and many other issues, also hormonal issues, oncological issues, metabolic issues, lifestyle related disorders, all kind of problems which we support with homeopathy. Here with homeopathy, we also work on lifestyle changes, nutrition, exercise, all together. When we work, the results are remarkable. Whenever you need our help, you can write to us. Our clinic details are written down. My email ID is here, gaurang@gmail.com. You can either come and meet us here in Mumbai, or you can also probably do an online consultation. Thank you.